am Dr. Sheila Mudhoo, consultant pathologist from Mauritius Island. I currently work at the Central Health Lab Laboratory, Victoria Hospital, Ministry of Health and Quality of Life. I am really happy to be part of the oncology training offered by Merck Foundation. I got this opportunity through the Ministry of Health and Quality of Life of my country. This training in neuro-oncopathology has been very beneficial for me, as I got more exposure to histopathology cases, to immunohistochemistry and molecular interpretation and techniques. At TMH, I had the opportunity also to see many cases, as I have done my training in neuro-oncopathology, that is in brain tumors, where I have seen like 4 to 5 cases every day, when compared to Mauritius, where I get to see 1 or 2 cases per week. And this will greatly help me in my work back in Mauritius in my laboratory, as I have learned new things, recent techniques that I can implement back in our lab and help, and it will be beneficial for our patients so that we can give a better and more accurate diagnosis, so that this will help in their treatment and further management. At the Department of Pathology at Tata Memorial Hospital, I have had the opportunity to see grossing techniques, staining, histostaining techniques, interact with the technicians, see how all the tissues are being processed and what tests are being done, follow all the techniques and the procedures, and even had the opportunity to go through the SOPs. And after that, I have assisted the supervisors, the teachers, and helped in reporting cases. And also I have managed to see how frozen techniques are being carried out, and also I had a bit of exposure in cytopathology. Most of the time I have seen cases in neuro-oncopathology, and I have managed to see some cases of breast, some cases of the lymphoid system, as well as the gastrointestinal system. Currently in Mauritius, the cancer is increasing in Mauritius. Though we do diagnose cancer, however, for further studies of these cases, like immunohistochemistry studies, molecular studies, we have to send our blocks to South Africa, the Lancet laboratory, and before sending these cases to Lancet, the patient history, the patient case file has to go through a tumor board, whereby it will be approved by the regional health director, by the treating specialist, and by the pathologist. And then this will go to the ministry for funding and to be sent abroad. And this is costly, and at the same time it takes like 2 weeks before we get a more accurate diagnosis. And when it comes back, then it takes time, and this delays in the treatment for the patient. Currently in Mauritius, we have 5 regional hospitals, but unfortunately we have only one central health laboratory where all biopsies, all specimens come to that place for histopathological diagnosis. And we don't have a cancer hospital in Mauritius. We have only one radiotherapy unit, that is one cancer unit in our hospital, where patients from all over Mauritius, they come for treatment at this particular department. When I go back to my country, I will use the acquired knowledge in order to implement what I have learned here, especially concerning immunohistochemical studies. We already have a Ventana machine at our place, but we don't do immunohistochemistry for brain tumors. So I will see and write to the ministry so that we can have these reagents which are specific for neuronal markers, to be able to buy them, and we can do the immunohistochemistry in our laboratory itself. I mean the basic markers, and maybe in the future, maybe not in the near future, but maybe in some years we will try to get the molecular facilities also. And at the same time, when I go back now, I will conduct some CMEs with my technical staff, so that when I go I can train them, I can make them learn a bit more. Other technicians who have not had the opportunity for training, and of course my fellow pathologists, I will share what I have acquired here in TMH. Cancer awareness in our country is rather good, because there is a lot of publicity, of advertisement that is being done through TV ads and through radio, and we have so many NGOs nowadays, like for example we have Cancer Linked to Life, where they go to people and tell them to have a screening, for example for cervical cancer and for breast cancers, which is more prevalent nowadays and worldwide in women. And there's a lot of awareness, and people, if they have any kind of problem, like they have a lump in their breast, or if they have a problem concerning gynecology, they go to hospitals or to dispensaries. This training program offered by Merck Foundation has never been available before in our country. It is the first time for us Mauritian pathologists and technicians to benefit and to have the opportunity to come on such a training program. My message for the future batch is that if we could create a platform for cancer in Africa. I would like to thank first and above all Merck Foundation, Tata Memorial Hospital, the Department of Pathology and its staff for this very beneficial training program.